Blood pressure drug recall. What you need to know. Hello everyone. Welcome back to Discovery Learning Hub. Today we've got an important health alert to share that could affect many people worldwide. A widely used blood pressure medication has been recalled due to concerns about a possible cancer-causing chemical. If you or someone you know takes blood pressure meds, this one is especially for you. What's going on? Here's the story in brief. The U.S. Food and Drug Administration (FDA) has announced a recall of more than 580,000 bottles of the drug prazosin hydrochloride, which is used to treat high blood pressure, hypertension, and in some cases, sleep disturbances related to post-traumatic stress disorder (PTSD). The reason? The drug lots were found to contain elevated levels of a chemical impurity, specifically a nitrosamine known as N-nitroso-prazosin impurity C, which is a type of compound known to have potential cancer-causing properties. Because of this, the recall has been classified by the FDA as a Class 2 recall, which means the drug may cause temporary or medically reversible health issues, or the probability of serious health consequences is remote. Picture of medication bottle labeled prazosin. Simple infographic showing 580,000 plus bottles. Text overlay. Class 2 recall equals moderate risk. Why this matters? Why should you care? Well, hypertension, high blood pressure, is extremely common globally, and many people rely on medication like prazosin to manage it. If a drug you're taking is recalled due to possible contamination, it's important to understand what to do next. Here are some key points. The impurity found, a nitrosamine, can form during manufacture or storage of a drug. These compounds are classified by regulatory agencies as potential human carcinogens. Although the FDA says the probability of serious harm is remote in this case, the fact remains that the product does not meet the acceptable safety standard for impurity levels. Importantly, do not stop any blood pressure medication abruptly without consulting your doctor. Stopping suddenly could raise your blood pressure and increase risk of stroke or heart attack. What you should do if you or someone you know takes this drug. If you or someone you care for is taking prazosin hydrochloride, or suspects they may be, here's a quick checklist. Check your medication label. See if it's prazosin hydrochloride capsules. 1 mg, 2 mg or 5 mg strengths were included in the recall, and check the lot number and expiration date. The recall includes bottles with 100, 250, 500, 1,000 capsules, with expiry dates from October 2025 through February 2027 in some cases. Contact your pharmacist or physician. Ask whether your specific supply is affected by the recall, and get advice on whether you should switch to an alternative medication. Do not stop the medication on your own. As mentioned, managing hypertension is critical. If you need to change medications, your doctor will guide you on how to safely transition. Monitor your health. If you have been using the affected medication, talk to your doctor about your risk and what monitoring may be appropriate, especially if you take it long-term. How this happens and broader lessons. Let's zoom out and ask, how did this happen and what are the broader lessons? Pharmaceutical manufacturing is complex. Even with stringent controls, impurities can appear during synthesis, packaging, storage, or transport. In this case, the nitrosamine impurity exceeded the acceptable intake limit defined by regulatory frameworks. Recalls like this show the importance of regulatory oversight by agencies like the FDA and responsible action by drug makers and distributors. In this case, Teva Pharmaceuticals USA and AmerisourceBergen, distributor, issued a voluntary nationwide recall in coordination with the FDA. For patients, it's a reminder to keep track of which medications you take, keep the packaging and lot numbers, and stay informed about safety alerts. For health systems, monitoring for impurities, enforcing good manufacturing practices, GMP, and swiftly acting on detected issues is essential. For the general audience, awareness that even trusted medications can sometimes carry unexpected risks, and vigilant follow-up is wise. What this means for Nigeria/you. Since our channel reaches an international audience including viewers here in Nigeria and across Africa, I want to highlight the pertinence. While this recall is issued by the US FDA and concerns products in the US market, Many medications or generic equivalents circulate worldwide. It's wise for Nigerian patients and medical professionals to check whether imported versions of the drug or generic equivalents exist locally and whether they might be affected. If you're prescribed Prazosin or any other blood pressure medication, ask your pharmacist if they are aware of any safety alerts or recalls affecting that batch. If your health system uses locally or regionally manufactured generic medications, inquire routinely about quality assurance practices and regulatory status. Always keep a list of your medications, including strength and lot number where possible. This makes it easier to respond to safety alerts should they arise. Conclusion. To wrap up, this recall is a serious reminder that medicines, while life-saving, are not free from risk. Manufacturing and supply chain issues can emerge. The key takeaway: don't panic but do act. Check your medications, talk to your doctor, and if you're using Prazosin hydrochloride, verify whether your batch is affected. And if you need to switch, do so under medical supervision. If you found this video helpful, please give it a thumbs up, subscribe to Discovery Learning Hub, and click the notification bell so you don't miss future health alerts and learning content. Also drop a comment below if you have questions or want to share your experiences. We'll try to respond. Stay safe, stay informed. Thanks for watching, and I'll see you in the next video.